Yeah, hello. May the peace of the Lord be with us all. And greetings from the team, Time with the Midwife. Today we are going to talk about malaria. I've realized that most of our pregnant women do not take this illness very serious, but when it comes to other illness such as HIV, Hepatitis B, and COVID, we are all serious and we are protecting ourselves. But to be frank with you, malaria causes even much death because we don't pay attention to it. It causes much death, and its complications too are very, very serious. So I would like to throw more light on it, and in order for us to be very cautious. Okay, malaria comes as a result of one getting bitten by an infected Anopheles mosquito. Okay, so when it happens that way, it transmits the parasite into your blood system in the simplest way. That is where it grows, and when the parasite gets into your bloodstream, it affects your blood cells. So you can realize, or you can testify, that anyone who has malaria, in one way or the other, the person's HB or hemoglobin level drops automatically. Okay, so that's why most of the facilities, when you are being given an anti-malaria treatment, we add a hemoglobin to it to boost your HB level, because automatically it's going to drop. And dealing with a pregnant woman, that is even more serious and more complicated, because it's possibly causes lower abdominal pains, which can be like a contraction on its own, where the cervix is not dilating, but you have severe abdominal pain, and it's very serious. Most pregnant women suffer really a lot. You see, you will be at the facility, someone will come with a load. Madam, my time is up, I'm coming to deliver, I feel like my baby is coming. You review, do every assessment that you are supposed to do, and this cervix is not dilated. By the time you rule out malaria, you find out that the person is positive, and after treatment, everything subsides. And one thing I've realized is most pregnant women who comes with this condition testify that having malaria and you are term with contraction and with labor is painful than the normal uterine contraction setting in. I'm talking about labor. It's very painful. And aside this, it's going to drop your HB. It's going to affect your fetus, like the baby itself. It's going to affect. You see, most of the times, the pregnant women who test positive with malaria, at the end of the day after delivery, you realize that this baby too tests positive, and it's very serious. It's very, very serious. Let's pay much attention to it. When you find out that you have malaria, you have headaches, you have chills and fever, you have body aches, you have loss of appetite, sometimes vomiting, sometimes diarrhea, lower abdominal pains. These are the very common signs and symptoms that you will perceive with malaria. But mind you, malaria and typhoid comes with almost the same signs and symptoms. So you don't treat in the house, or you don't go to the drugstore. Over-the-counter medications is not allowed. You first of all have to test to know that it is actually malaria before you commence treatment. This part is very, very important. I need you to take it into consideration, because self-medication is not allowed, not even when you are not pregnant. So if you are not pregnant and you are not allowed to self-medicate, that means when you are pregnant, it's never allowed. Let's take note. And I've already talked about the signs and symptoms. Let's discuss how you'll be able to prevent yourself from getting malaria. We are being given SP when you are pregnant, sulfadoxine pyrimethamine. That is, you are given at the ANC, and you are supposed to take it right there where your midwife is observing you. you are to take it 5 times during your pregnancy, a month interval. So this means that when you are pregnant, you have to report very early, okay? And you can only take it after quickening, that's from 16 weeks upwards. So we have to take our antenatal very serious in order that we'll be able to take this medication. It's a form of prevention. It will prevent us as well as our babies from getting malaria. After that, we also have the mosquito nets, insecticide treated nets that we use. That also prevents us from getting malaria. People complain that the mosquito nets, when you sleep in it, is very hot, it's uncomfortable, and that. But it saves us a lot of money. When you get malaria and you're treating it, it's very serious and it's exhausting, and it's going to cost you a lot of cash that you would have been able to use it for something very important, but meanwhile you're going to use it for the treatment of something you could have prevented. So let's take it into consideration. Also, if you find it difficult to sleep in the mosquito net, there are other ways, like using the mosquito coil or using the mosquito repellent cream. You can also use spray, insecticide spray. That one too is available for you to use to prevent yourself from getting malaria. Also, when you are using the spray, let's take it into consideration that you won't have clothes hanging in the room. You see, some people have a crossbar and they will hang. I'm talking about in our vicinity, like in Africa. You see, some we use one single room for our hall and our bedroom. So we have this crossing bar that we hang our things. If you find yourself in this situation, you don't have to hang so many clothes, because mosquitoes dwell mostly in dark places. So you have to take all these clothes, fold them well, and keep them in a clean place. If not, spraying, you have to make sure that you spray all these areas very well in order that you have to get rid of these mosquitoes. Also, let's make sure that we have tanks that we keep water, or we store water in it for a long time. You have to make sure that it gets a lid that you will cover to prevent the mosquitoes breeding, because that stagnant water serves as a breeding place for the mosquitoes. So let's make it a point that we will get a lid, a well-fitting lid to cover it. Also, we have to make sure that our gutters are not choked to keep water at a stagnant place, which will also serve as a breeding places for the mosquitoes. When we use empty cans too, we have to make sure that we use whether stone or anything to just make it flat. We don't have to leave it open like that, so that when it rains, it will not collect the rainwater, which will stay in it for longer time and then serves as a breeding places for the mosquitoes. In other way, they are come to bite us and infect us with malaria. So let's make it a point that anytime you use empty tins, after using it, let's make it a point to press it to be flat, or better still, bury it to prevent it from collecting rainwater. These are most of the preventing ways that we're going to talk about, and make sure that behind our houses are cleared, they are not bushy. They are all preventive measures. And after doing all this, let's take it in one way or the other, you get infected with this malaria, you should make sure that you report to the facility on time. You shouldn't self-medicate. Get to the facility, get tested, make sure that it is positive before you start any treatment. And once you start any treatment, aside quinine that you are given in the first trimester, any other medication, that one is for 7 days, but any other anti-malaria treatment is 3 days. Make sure that you complete the 3 days. If you don't complete, you take the first day morning and evening, the second day morning, and you leave the rest. You have not done any good to yourself. So once you are on an anti-malaria treatment, you make sure that you complete either the 3 days or the 7 days, and you also make sure that you add your iron supplement. You eat well to balance the drugs that are being given to you. I wish you all the best. Take care of yourself, protect yourself, and stay safe. COVID-19 is real. Protect yourself. Next week, this same time, we will meet. It's Time with the Midwife and your host, Tammy Senior. God bless you for watching.